Now, even at birth, teeth are there. Yeah? So you don't say that having teeth is now a disease. Someone says that teach them when they are still young, so that when they are old,
they will not go away from it.
The moment you have seen a tooth, you should at least visit a dentist for this advice that now I am giving you.
Wow.
Understand?
Yes.
So that within the first year, every child in Kenya or anywhere should have interacted with a dentist.
Welcome back to the Mamatoto Lounge, where we are still on parenting journey, all unfiltered. In our specialist corner, we have a very special guest. And before I get there, we are at Premier's Hotel, and right in front of me, there are quite a number of cameras from Chanuka Studios. I am your host, Shikari Rosemary, your lactation specialist and your doula. Here we are introducing Dr. Shem. Karibu sana. You tell us more about yourself, and it's been a while, and mothers asked a lot of questions, and that is why you are here now to take care of their babies. You are here, you took care of them when they were pregnant, and so a lot of concerns, and that is why you are here, Doctor.
Thank you very much.
Karibu.
Thank you very much, Shikari. It's always a pleasure coming to Mamatoto Lounge. It's always a good place. You are very lovely. I like the place. Very good place, prettiest. So it's very nice.
Asante.
Yeah, so I will introduce myself again for those who are not having an opportunity to see me the last time I was here.
Awesome.
I'm Dr. Shem Rakewa. I am a dentist, a dental specialist with a lot of experience on teeth. I think I've been doing teeth for now more than 15 years. Yeah.
Wow, that is rich.
Yeah, people get shocked. So it's nice when a colleague also gets shocked. So I have done masters in public health. I am currently a registrar of oral and maxillofacial surgery at MTRH. So we really handle a lot of dental concerns, and we run a practice. I run a practice at Dr. Shem Dental in Mega City and Platinum Dental Clinic, which is in Nairobi, Langata area.
Beautiful.
Yeah.
You're doing a very good job, Doctor.
Yeah, we try.
And thank you for having this precious moment to share with us and our parents outside there.
Thank you.
All right. Now, first things first, mtoto amezaliwa. Hana meno, so we are not sending the baby to Dr. Shem. But how do we take care of the oral hygiene?
No. Shikari, you are right and almost right. Some children are born with teeth. Have you heard of that?
Yes, I've heard.
Yeah, so still you'll run to us.
We will still run to you.
Yeah, so when a child is born, a child may be born without teeth. That is a lot of percentage, like 99%.
Yes.
In the rare occurrence that a child is born with the teeth, we want you to still see us.
Aha.
Yeah. So we don't want you to run to the traditional herbalists.
True.
Yeah, like in Kisumu, they are somewhere.
Yes.
Yeah.
Yes.
But we want you to run to a private or a public institution that is registered, so that you get professional advice about what to do with these teeth.
Wow.
Yeah.
Yes.
So that one is for the rare percentage, the 1%.
For the and that 1%, Dr. There are things that I have seen. Actually, I've seen a child born with a tooth.
Yeah.
But some I've not seen, but have been forced to see. Daktari woni ini plastic teeth, awoni iyote ya white daktari ini meno. So how do mothers? Because the role of a mother here is just to suspect, and just to be anxious or just worried and concerned, and then come to you.
To us,
So how? Tell us something about the plastic teeth, or.
So that is why we are here.
Yes.
And that is why what I said is, we must see a registered practitioner.
Yes.
Because we see teeth a lot, you see mothers a lot. And we'll be the guys to know, is this normal teeth or this is abnormal teeth? So yours is to suspect and then refer to us. The mother too is supposed to suspect, inform you, and then you can make your decision. Now, even at birth, teeth are there. Yeah? So you don't say that having teeth is now a disease. No. Teeth start developing in the uterus, in the uterus, when the child is still inside the body.
Yes.
And the expression of teeth is a process that took more than 15 months by the time the child is showing you teeth. So having teeth is there. Some people will see them under the gum before they come out. And that is when we need to take care of them.
All right.
Yeah. So we need to take care of the gums, and we need to take care of these teeth as early as that moment.
As early as that moment.
Yeah.
So how do we start?
Yeah. So we have to start simple.
To start simple.
Yeah.
I love that.
And as we start simple, we have to make it fun. Yeah?
I agree.
So that this child grows with this habit going on. So as much as when the child is born, they have gums.
Yes, they
or
do.
teeth. Let's talk about the 99% now.
The gum.
Yeah. Now we have the gum. So we want to introduce this child to cleaning.
Yes.
What do we do? You have just had the first suckling reflex. What do we do? Follow it up with the cleaning. So you get your something to clean the gums, which can be cotton wool, or you can use the cotton cloth. But it must be clean.
Okay.
Yeah. So it must be a part of the things that you are sterilizing if you are a mother.
Yes.
Yeah,
So we
that
sterilize a lot.
After the feeding, you introduce this. So that when the child is now 6 months and the tooth is picking, you just don't say peekaboo. No, you say peekaboo. Because the children really like that. That's their first game.
That's their first game.
Yeah, so you say peekaboo, and then you feed the baby and also brush the tooth. Or you say peekaboo and brush the tooth. So this child, we are trying to do association. Tooth cleaning and fun. Yeah, so you say peekaboo and brush the tooth.
And brush the tooth.
Yeah, so that's what you want to do.
I have seen when mothers are doing nowadays shopping, there is a nice container that is called, like, is it a self-care or baby care?
Yeah, baby care.
And one of the things that I picked was a beautiful thing here. Have you seen it?
I don't know how you hold it, but we'll try to hold it.
Like
so
you
that
can put it, yes.
Yeah, it fits here.
Yes.
It fits here.
Yes.
So this is like the baby's first toothbrush. Yeah, and you can see it's so friendly.
Yes.
Unfortunately, I have fingers that are thick, but I think we can use the picky
finger.
Yeah,
yes.
So that we are resembling the lady's fingers.
Okay.
So you'll use this. You can find there is a toothbrush, the brushing side.
Yes.
And it's very gentle.
It's very gentle.
Yeah. So this you can even use to brush the gum of the child as early as 1 day old.
Oh.
So you can sterilize this. This is so beautiful.
Wow.
I don't think it costs much.
No, it comes in that kit. I've seen it in the kit.
Yeah,
the kit is around 800 and it has many things.
Yeah.
But this one got me
interested. I'm sure they throw it away.
Oh, yes, they do.
So now instead of throwing it away,
because you don't know how to use it.
So let's learn together. So now we were at the bristled side.
Yes.
So brush the gum.
The gum.
Actually, you can even give the child to suck, but also do the movements. Let's have this be a routine so that the child can
looks fun.
Can know it's a routine and it's fun.
Yes.
Yeah, as early as that moment. So now you can use this for the gums.
Yes.
Now later on, we have the rough end part, which we can use to now clean the tongue. Yeah. So you do this to clean the gum and clean the tongue. As the child gets the new teeth, then we introduce something else.
Wow.
So now we introduce a small amount of toothpaste. And you don't want to do a whole sandwich of toothpaste on this.
No.
So you start with a rice grain size.
Hey, kadogo?
Yeah.
Rice grain size. That's very small.
Very small.
Yes.
Even if you buy the long grain rice,
yes,
you can use that, but it still be reasonably small for the baby.
All right.
So now put that rice grain size for the child to get to understand that something has been introduced.
Yes.
And it's small.
Yes.
It's my size, and it's not too much. Put it here and brush the 2 tiny teeth.
Yes.
Yes. So the child gets to understand. So now we are talking about a child with 6 months.
Yes.
2 teeth. At around 10 months, 4 teeth.
4 teeth.
Around 12, we have
now like
another
6.
6. Yeah. By the time they are 24 months, that's 2 years. They have a whole set.
Yes.
And these would be useless now.
Yes.
And the rice grain will also be too little.
Aha. So we keep increasing as the baby is growing, or as the number of teeth
is growing. But don't pass the pea size. I don't know if you have peas here in Kenya.
Yeah, peas is minji. Yes, we have minji. Peas is minji.
So let's use minji size.
Yes, minji size.
Minji size is the maximum you can give a baby until 5 years.
Oh.
Yeah. So you have to don't use beyond the minji size.
You know, this is quite amazing. I'm equally unlearning a lot.
Yeah.
So we've introduced a grain size, a rice grain size.
Yeah.
Do I use the regular toothpaste that I use, or what? Is there a special toothpaste?
Do you know this child would end up taking this toothpaste and swallowing it?
Oh yeah, definitely. At 6, 7 months, they will just swallow everything. Not unless they don't like it and they'll.
Yeah. So most likely they like it because it comes from mama. Or their favorite caregiver.
Yes.
Yeah, so they have to accept it because you've introduced it gently. So they'll accept it.
Yes.
So we are not going to talk about a specific brand of toothpaste, no.
Yes.
We are going to talk about what do you want this child to use all through their life. So that's why we don't want you to buy a special toothpaste for this child, because you never know.
Okay.
Yeah.
Okay.
So we want you to use the regular toothpaste, a small size as we go, so that even if they consume the small size, we are not having any risk of health problems. Yeah.
It makes a lot of sense, because when we are doing complementary feeding,
yes,
I teach mothers to introduce the family meal.
Yes.
Don't have a special pot.
Don't have a special thing for this child.
Aha.
Because then they'll fit in. They'll feel like, why this for me only?
Yes, for me. Yes, and
why
they struggle.
For me? Is it so bad that anybody? And then they'll have the anxiety that, let me try the adult thing.
Yes.
Yeah, so let's use what you will allow this child to use even in adulthood.
And the baby will grow and fit into
this. So now we've moved from the rice grain, we've gone to the pea size, and now we can use the size of the nail. Your nail, that is the size of toothpaste you should use. Your natural nail, for that matter, in order to be fair to our other people. Natural size of the nail.
Okay.
Yes. If you know, you know.
If I know, I know.
No. I've not said anything. Please let me not be quoted. The size of the natural nail, so that we don't stand. We waste a lot of toothpaste even as adults, and most of it end up in the sink. So as much as we want to get sets of toothpaste, let's also not be very careless.
I will not ask about the size when it comes to adults, because I want you again here next time.
Yeah, definitely. Thank you.
So let's concentrate on the babies.
Yeah.
So now this baby is growing.
Yeah.
And at 6 months, we are somewhere, we are getting used, and it is fun.
Yeah.
Will the diet that we introduced now, it's 6 months of exclusive breastfeeding.
Yeah.
We are so happy baby is getting integrated in the family pot.
Yeah.
Is there an issue with the diet that will affect now the oral health, or, you know?
Whatever gets into the stomach stays on the teeth. That is the statement we want to conceptualize.
Whatever gets into the stomach stays
on the
tooth.
Yeah.
Okay.
That's true.
That's huge.
Yeah, it's a statement that holds. Because if you are eating things that are sticky, they'll stick more. If there are things that are not sticky, they'll not stick as much, but they'll still stay there. So now we have to focus more on things that are non-sticky, non-sugary, and they can have more vegetables and more fruits, so that this child has a healthy diet. Yeah, because every lollipop has a story about a cavity.
Wow.
Every lollipop has a story about a cavity. So if you give this child a lollipop, then we know there is a cavity that will have a story about that lollipop when it goes to the dentist. Yeah. So now we don't want to condemn the companies. They are our sisters.
Oh,
they,
yes.
They produce these things and they make us have work. Eh?
Yes, and happy.
And happy. But then we have to eat them, yeah?
Yes.
But now we can focus on when do we eat? When do we eat these things that make our lives fun? Like, we like ice cream. When do we take it? We like cake, yeah?
Oh, yeah.
Yeah, when do we take it?
I'm a sweet tooth.
Yeah, so we want you to eat more of these cakes because we have to have bakeries too. But now, when do we take them? So we want you to take them alongside the major meals. Yeah, so whatever you are taking, have a whole bowl of sweets, have all the cakes for the day, all the biscuits for the day, but eat it alongside our ugali or rice during lunch hour or during dinner or early in the morning, so that we minimize snacking in between. And then you know what we started off earlier?
Yes.
Every major feeding followed by a moment of cleaning.
Yes.
At that moment, you'd be brushing. So now you've taken your whole kilo of ice cream, but then you brushed. Did it stay there?
No, it stayed.
Or if it stayed for the duration you are eating.
Like a short duration.
Yes, so you are just okay. So keep on eating cake. We need you healthy.
Wow.
And lollipops too.
You know, Doc, these snacks come in between when either you are not home, you know, so baby will go to church, Sunday school.
Oh, we're talking about babies here.
Oh, yes.
But you
come
said
back.
you are talking of cakes too. Okay, so baby is eating cake.
Yes.
So the baby should eat half a kg of cake alongside the food. And now baby is carrying snacks to church.
Yes.
And we need to discuss this too.
Hey. No, let's go step by step. We were at introducing the diet.
Yes.
We are doing complementary feeding.
Yes.
And you said anything that goes to the stomach
sticks on the tooth.
Yes, sticks on the tooth. So when we are choosing the proper diet for this child, we choose more of non-sticky. Yes,
non-sticky. Now, when we are choosing the diet, I'm not a nutritionist, but we'll talk to the nutritionist.
Yes.
And most of your foods must be of that non-sticky nature.
Okay.
Yeah, and even if we have to take the sticky ones, remember they have to be served alongside the major meals.
Oh, right.
Understand?
Yes.
So now you want to serve your child the cake, you have to remember to clean. You've carried the child to go and feed during church moments. And now those moments you really don't want to serve very sticky foods. But even during those moments, remember we had already inculcated the habits.
Yes.
Of let's feed and brush. Or let's feed and follow it with water. Now this child can easily feed, take water.
Yes.
Now this is the moment you introduce clear water. Because it doesn't make sense to follow it with juice.
And we always follow it with juice.
So follow it with juice, but finish up with water.
Like the final
must
sip
be clear.
Must be
clear water. Clear water, and then follow through with your brushing if you can. But you look like the odd one out, but be the odd one out.
And stand out.
And stand out.
Beautiful.
Yeah.
So this baby of ours is really growing very fast now, Dr. Rin. So I'd want to ask, as a mother, when should I bring my baby for the first dental checkup? Should I wait until now it's shaking and I'm so afraid?
This baby should have already been at the dentist.
What do you mean?
Yeah, in fact, we are going to have to be like, make it a policy that the dentists become part of the guys, the specialists who welcome the baby to the world, so that we can check and pick any issues earlier. So yes, we may not be well staffed or trained adequately to receive every baby in Kenya, but the moment you have seen a tooth, you should at least visit a dentist for this advice that now I am giving you.
Wow.
Understand?
Yes.
So that within the first year, every child in Kenya or anywhere should have interacted with a dentist. So what happens during this visit? we want this child not to see me when they are 4 or 5 years and they are running away.
Yeah.
I want this child to remember me. I want me to carry this child when I can still carry the baby on my lap.
Yes.
I want the child to walk when I'm with this child, so that she knows I went to Dr. Shem and I left smiling. Because I didn't have a problem. Now mommy has taken me to the dentist and I may have a problem, but I know I can go to Dr. Shem and come out smiling. So when is the best time to take the child to the dentist? First year. The first year you should have the child see the dentist. Whatever happens is just 1, diet counseling. 2, make the child know the environment.
Yes.
3, check if there is anything that can be done, any problems. But the main thing is diet. 2, we want to talk about the patient, the child, in this case, having the experience, knowing that this is a good place. Because many dentists spend a lot of money just to have sections for children.
Wow, yeah, true.
Yeah. So why not? Come and use these spaces.
That is amazing. So when was the first time you took your baby to the dentist, and how does it feel? Now we know. We will not wait until that first tooth. And actually we go running to the dentist when we are unable to remove that first tooth. In any case, I think most parents are nowadays, I think us growing up, we remove these teeth by ourselves. But nowadays, I see it when parents will ask me, which doctor can I go? Or do I just remove it? Or should I just push it inside? So I think that's the time that most parents will come running.
So mostly people visit us because of the 3 issues. Either the child is suffering from thumb sucking, or they've refused to let go of the pacifier. The child has fallen. If it is a boy, they say terrible twos. Yeah. Or they have cavities. Or the tooth has stayed for too long and it's shaking now.
And it's another one is just
popping.
Yes.
Yeah. So these are the reasons why many people visit us. Yeah. So you have to ensure that the cavities we've really talked about, you want to prevent them. Trauma, do you really want to have a safe environment for this child?
Boys.
Can you maintain?
Boys.
Can you prevent boys from falling and experimenting? Just get the environment safe for the boy child so that they don't lose their front teeth.
Is it enough? Now, before you even tell me if it is enough, I have a friend here.
That's
who is not very friendly.
So this is a pacifier. So this is a
That's a pacifier.
A lot of issues. We can talk about the pacifier till morning. But I feel it is better than the other problem why people come to visit us, the thumb sucking.
The thumb sucking.
Because it can replace thumb sucking. And thumb sucking and this should not go beyond 3 years. So if I hold this, I just want to talk about the key things because we are limited with time. So the first thing is, anything we have, we should never say it's bad. Are we together? So first of all, let's appreciate that it is there and it can replace the thumb.
The thumb. Okay.
So it's a good thing.
Okay.
Number 2 is how long are we going to use it?
Yes.
We don't want to use it until the child is 5 years. So when do we stop? It is 2 years. Beyond 3, we are having problems. Number 3, how do we use it? Use it the way it came. If you want to add anything, add water.
Yes.
Are we together?
Yes.
Because if you say you want to add juices, then they have acid in it.
Yes.
And they will sleep with this.
Yes.
And you soak your new teeth on acid. And you want to be happy tomorrow with weakened teeth.
Wow.
So whatever we are adding here is plain water. Let's not add sugar. Let's not use juices. Let's not do anything. Don't add anything if you want to use it well.
Okay.
So now 3 things about pacifier. The first one was, it is not bad. It can replace thumb sucking.
Yeah.
The second is, when do we stop? Not beyond 3 years.
2 years the better.
2 years the better. The third thing is don't add anything. Use it as natural as it came. Are we together?
Yes, we are.
Does it stop? You got another one?
I have so many. Look, I have so many and I don't like it because now as a childbirth educator, it interferes with feeding. Because sometimes the baby is leading the mother to the queues, and whoever who is left with the baby pacifies the baby to continue with some errands.
Yeah, definitely. That's why I said these things, we can use them and use only them when they're beneficial to us. Let's not be slaves to technology.
You're right.
Yeah, let's not be slaves to technology.
Let's pacify the baby when we need to pacify the baby, and not just,
use it as a scapegoat for responsibility.
I agree. I think
that's a tough one. When laziness creeps in and you have to use your pacifier, don't use it.
No.
Okay. And don't sweeten it.
And don't sweeten it.
You have agreed.
We have
3 things you have agreed on. It's a good thing. Let's use it well.
Yes.
Yeah.
Because I've seen there are others that are coming, that this place can be opened, and you can squeeze in some grapes and some strawberry.
Whatever you squeeze in, we don't want you to squeeze in.
We do not want.
Because we cannot control what you can squeeze in. So let's not squeeze in. We can't control.
We can't.
The next time the baby, you can put in your citrus fruits. The next time you may put in a banana. But really, we can't control what you are squeezing. So let's just avoid.
Let's just avoid
Let's just not have a whole lecture on things you can squeeze into a pacifier. And we have a 45 minutes talk about it. At Mamatoto Lounge, that will be too much. Let's just start by, let's allow only water.
Yes.
Let's allow only water.
If you must, just only water.
Yeah. But in the case that our dear mothers have squeezed in stuff, please tone it down and introduce water.
Introduce just water. All right. We are doing a very good job, and I'm very happy. But as we conclude, I have seen something, I don't know if it's my eyes, but nowadays I'm really seeing children with a lot of brown teeth or cavity at very early stage. Is there a point of concern, or is it a data that is only on my eyes?
You're right. It's really worrying. It's really worrying that we are having an upsurge in early childhood caries. That's the word.
Early childhood caries.
Yeah. So the early childhood caries comes in when we are feeding the child wrongly. So in this, we are feeding the child wrongly, and we are not following the principles, the things we talked about here. I call them the gospel of taking care of teeth. And the gospel states that you have to brush. And if you're brushing for this child after every meal, then this child would not develop early childhood caries. But now we have those who now the baby is waking you up in the middle of the night. And unfortunately, for lack of a better use, you just you breastfeed the baby. And the baby goes back to sleep.
Yes.
When do you withdraw? When do you stop breastfeeding the baby? Because definitely I hear that as the baby is breastfeeding, I'm not a lady, but it also suits the mother.
Oh.
Yes. And the mother sleeps.
Okay.
Sindio. And the mother falls asleep and leaves
the baby
breastfeeding.
Yeah.
So the baby sleeps with the mother's milk in the mouth.
Yes.
And the baby is most likely 1.5 years old with the milk in the mouth.
Yes.
So now we are soaking teeth in milk. Are we together?
Yes, we are.
And the mouth already has bacteria which cause cavities. So this bacteria will use their milk to produce lactic acid. Now we've moved from soaking the teeth in milk to soaking the teeth in lactic acid. And the mother is still sleeping.
Yes, actually, it's the breast that is inside there now.
Beautifully said. At least it is nice when you say it.
It's from the lactic.
I was really avoiding saying that. Yeah. Thank you.
Yes.
Now you've soaked the teeth consistently every night for 3 or 4 hours in milk lactic acid for 6 months. If you have to breastfeed before 6 in the evening. Let the child know that at night we are not breastfeeding.
Yes.
To go back to sleep.
Yes.
Yeah. Okay, same to feeding.
Feeding.
Not all of us are having the luxury of having breasts.
Yes.
Still feed this child, and let's reduce feeding at night. So feed this child, brush the teeth, let the child go to sleep. Let's wake up in the morning and continue eating. So eating is not a continuous process. Yeah. So these are the things. Okay, I'm not a nutritionist, but I know if you feed, I'm also a father.
Yes,
I know if you feed this child well between 6 and 8 in the evening with heavy nutritious food and brush this child's teeth, this child will have a very nice sleep.
Peaceful sleep.
Till morning. Yeah, so why do we want to endanger the children's teeth? And obviously, now, these are for the normal children. And we are lucky to most of us to have normal children. Now we have the special needs.
Oh, the special needs, yeah.
Now we can forgive them.
Yeah, that's different.
Yeah, but now we just have to think about how to clean their teeth.
How to clean.
Have this information at the back of our minds.
Yes.
And even as we take care of them, let's clean their teeth. This child who needs syrups all the time, why can't we also finish the syrup, get clear water? And let it be a fun habit. Let's not be boring. Let's not be an instruction. Yeah, so baby, today you are unwell. I've brought the beautiful Calpol, the sweet one they like, and then I've carried water. Or I've brought the bitter one, but I've also carried water.
Yes.
Mommy, let's take this very fast and
then take water.
Immediately. And there are kids who I've seen who are doing that. And they'll still have nice teeth, even in their special states.
Wow. Habit formation.
We have to inculcate the good habits.
Early.
Very early. And let's love water.
Yeah. By the time they even 7, 9, 10, they won't even remind them.
They know. And they know by the time they understand that this is why we were doing it, they are adults and they can continue. What does someone say? Someone says that teach them when they are still young so that when they are old,
they will not go away from it.
Yes, someone said that.
my brain right now is rushing like this.
I told you. Why are you prepared for this?
I was not prepared. I was not prepared at all. And you know, I like this because they are the simple things right in front of us. It's taking a syrup. And nowadays, these syrups are also flavored, highly flavored. Because I think everybody complained a lot, no, this is kali. So they all come very much flavored. Yeah. We are giving and immediately soothing the baby to sleep. So the baby is sick. Yeah. You give the Calpol and soothe immediately and you forget about the oral.
So why not? It will not hurt you.
It will not hurt.
Get the syrup with water.
With a syringe or something.
And water, yeah. Why not? Why not? So this is very informative for the ladies and the caregivers.
Yes.
So they need to appreciate that dental care is very important to the well-being of the child. Because once the child is having cavities, this child will not have some meals.
Yeah.
And they'll end up wasting. So we have to have nice teeth so that you can have healthy bodies.
Why do I feel like you've given us a parting shot, Doc?
It will be enough. Let's have.
You have heard it from our guests, Dr. Shem, that the earlier we do this, the better. So if you want to take good care of your teeth and baby's teeth, Dr. Shem is there. And the basic is we are starting this as early as we can. Doctor, do you have any other parting shot?
No.
That is it.
I'm grateful.
You are grateful.
It's always a pleasure coming here.
Asante sana. So once again, we are at Premier's Hotel. Thank you so much for having us and hosting us. Until next time, don't forget to subscribe, share, and leave a comment. Let us know what else you want us to talk about here, where we do a lot of unfiltered, unlearning, and learning. This is the place. Thank you and bye.